welcome back to Retrieving Sanity with your podcast host Keegan, and this is your podcast for all mental health, addiction, recovery issues, and topics. And today we have a very special guest, and she is a former nurse practitioner, sorry. You got to have a little bit of something right there. You don't just practice neurology. And she's also an author and the author of After the Crash, detailing what it's like to have suffered a traumatic brain injury and how she helps others heal, overcome the same struggles she once did. And her name is Kelly Tuttle. How are you doing today?
I'm doing fantastic, Keegan. I'm excited to be here. How are you?
Well, I'm glad to hear that you're doing fantastic, and I'm glad that you're on the show. I'm actually ecstatic that you're on the show because TBIs are one of those things that, well, a lot of people don't really know what they are, but they affect a lot of people and they don't even know it. So tell me a little bit about yourself. Where are you from? What is your book all about?
Sure. So my story starts with the thunderous clap of metal and shattering of glass, people coming out of their homes to see what happens, sirens approaching. And I had been driving down a road, leaving work. And at the time, I was a cardiology nurse practitioner. And another driver pulled out in front of me, and I couldn't stop on time. And so I ended up T-boning them. And I thought at the time, hey, I'm just going to shake this off, get back to life, and it'll be all good.
Mm-hmm.
And 3 months later, driving home from work, I fell asleep at the wheel. I
Oh.
bounced off the road. Fortunately, the jarring woke me up, and I was able to slam on the brakes before I ran into a tree.
Ooh.
And this is how well my concussed brain was working. I thought, oh, okay, I'm getting tired on my drive home. I guess I'll just take a nap on the side of the road, and then I'll drive the rest of the way home safely.
Mm-hmm.
Okay, I don't recommend that for your listeners, sleeping in your car on the side of the road. But this is how I was thinking. I was so
Yeah.
desperate to get back into life, be a mom,
Mm-hmm.
working, long commute, and didn't realize what was going on. And so then I had lunch with a colleague who was a neurology nurse practitioner at the time. She was very curious about my recovery because
Okay.
I told her I'd had a concussion.
Mm.
And I mentioned falling asleep at the wheel. And
Mm-hmm.
she's like, what? And I was
Oh
like,
no.
yeah, but it's okay because now I'm taking this nap. She's like, no, 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 it's not okay.
Mm.
You you need to see a physical medicine and rehab doctor, PMR. They are doctors that used to be called physiatrists. They
Okay.
specialize in brain injuries and spinal cord injuries, and you need a brain scan. These things I hadn't had done. I just saw my general practitioner and
Mm.
was told, you have a concussion. I'll take you off work for 2 weeks. I assumed I'd be better in 2 weeks, and I wasn't 3 months down the road. So
Oh
then
boy.
I saw the PMR doctor, despite my head CT and my brain MRI being normal.
Mm.
She said, yeah, you have a concussion. You've got diffuse axon shearing. This is
Mm.
when, if you think of brain cells like trees, they have branches that go up and roots that go down below. Well, when
Mm.
you have a concussion, those get sheared.
Eesh.
And so she could recognize from my symptoms kind of how I was behaving during my exam,
Mm-hmm.
that I had suffered a pretty good concussion, maybe mild to moderate TBI.
Mm-hmm.
And she referred me to a speech therapist and a neurotherapist and physical therapy because I had horrible uh, whiplash on top of
Mm.
it, everything else.
Mm-hmm.
And from there on, I started going on the right road to recovery.
Okay.
And
Holy
at that,
cow.
I know, right? And then she took me off work for 3 months. And
Oh.
so I did really intensive therapy. I rested. I allowed my brain to heal,
Mm-hmm.
did all the things that were recommended, walking, mindful thinking, getting the rest, making sure I had good quality sleep.
Mm-hmm.
And then it was a couple weeks before I had to go back to work, and I was freaking out because I was like, I don't even know what my brain needs for me to be a good nurse practitioner when I go back to work, right? And I was like trying to read my books, look on the websites, what can I use? What do I need? And so when
Mm-hmm.
I decided to write my book, I decided that I would write a book that specifically talked about how to go back to work after a concussion or a brain injury. I wanted everything a person would know to go back to work all in one place so they wouldn't have to
Mm-hmm.
try and read several books or go to various websites, because after a brain injury, you can have neurofatigue. You can have difficulty with
Mm-hmm.
reading and your memory and
Mm-hmm.
processing, learning new things. And that's the last thing you want to do, is pressure someone who wants to go back to work
Mm-hmm.
with this additional research on the internet and so forth. So I really wanted to make it so that they could grab my book and have everything they needed to get started right
Mm-hmm.
there with easy access of strategies and tools they could use right away. And then I also I put my book on Audible for
Oh.
individuals who couldn't read or had
Mm-hmm.
difficulty with memory, or they had difficulty with vision,
Mm-hmm.
so that they could get to the information just by listening.
Wow, that's awesome.
Thank you.
I'm really glad that you put it on Audible, because that does make it way more accessible to a ton of people.
Yeah.
And did you have to narrate it yourself?
Yes, which was a big learning curve. It was really interesting and it was exhausting. It totally kicked my butt.
Man, I was about to ask if that neurofatigue kicked in whenever you were doing that, because I know that I have to read a page once a week for my recovery meeting, and one page can be like a doozy sometimes, you know? So doing a whole book for everyone, I can't imagine how much of a mental toll that would have been every time you picked it back up. But
Yeah, it was
that's
serious.
that's so cool that you were able to do it though.
Well, I had
And
a
I mean,
fantastic engineer, sound engineer, who was super supportive, and
mhm,
he would read along with me, and he would catch if I pronounced a word off or if I changed the sentence. You know how you don't read, you kind of skip, yeah. So that was really fantastic, and he was super understanding of having to redo stuff and kind of let me rest and so forth. So it was a good
that's awesome.
experience.
That's awesome. And I think you get a little bit of bragging rights being able to say, yeah, I have a book and it's also on Audible, you know, because not a lot of people really have a book and it's on Audible. And if they do, they probably don't narrate it themselves. So kudos to you. That's awesome.
Thank you.
Of course. And boy, oh boy, TBIs. You just said the word concussion, and I've had a few of those, so I'm curious myself. What defines if it is an actual TBI instead of just a little bonk on the head?
Very good question. So, as I said, my MRIs, my initial MRIs and CTs were
Mm-hmm.
normal.
Mm.
And so just because you're told your CT scan or your brain MRI is normal doesn't
Mm-hmm.
mean that that you don't have a concussion, that you're not suffering from those symptoms, because
Mm-hmm.
those scans are great at picking up skull fractures, tumors, and bleeds, but
Mm-hmm.
they can't visualize what's occurring at the cellular level, at the place
Mm.
where your symptoms are originating from. So the
Oh,
diagnosis as of now is based on your history of your injury and your
mm-hmm.
symptoms and how long the symptoms last.
Hmm. Okay. Interesting. So a little bit, let's see. Let's go back to the first big concussion I had. Let's see if that would maybe go along with the TBI. And I was 5 or 6 years old, and me and some friends were racing on some bicycles, you know, and of course, being that young and unsupervised, I didn't have a helmet. And I accidentally ran over a friend, and my forehead hit the pavement really hard.
Uh,
And I remember kind of like passing out and seeing my dad like kind of pick me up. And then I remember waking up on the living room couch and being like, oh, hey, mom's cooking dinner, and trying to go into the kitchen, but I could not walk at all. I lost all sense of mobility. And then they took me into the hospital. I had a big old bruise on the x ray, and they were like, yeah, that's a concussion. And they said he might have some memory problems for about a week. And that was it. That was really the last I heard of it. And
yeah.
I was like, maybe I should have had that looked at a little bit more, but would I couldn't walk. I did have memory issues. I definitely had some. I have a like dent in the skull. So
Hmm.
would that be something someone would be like, yeah, that was a TBI? Or was that just a, nah, he just fell and hit his head?
No, that would be a TBI.
Great. Yay, I'm in another club.
And then, I mean, there is a myth currently at the front line of healthcare
Mm-hmm.
that if you get a concussion, it's an acute injury, and after a couple
Mm-hmm.
weeks, you're better and you go on your way. More and more, what we're finding is that's not true.
Mm-hmm.
Even recently, Medicare just approved that a TBI is a chronic condition. It used to be just an acute. So now they're
Mm-hmm.
acknowledging that it is a chronic condition. And the reason why it's a chronic condition is that people who have head injuries
Mm-hmm.
have a higher risk of developing degenerative disorders later on in life, such as Parkinson's disease. And
Oh
we're
boy.
finding there's a higher risk of developing anxiety, depression, and suicidal ideation or
Mm.
completion.
Ooh.
And so it is something that really should be taken care of.
Mm-hmm.
It should be like, when you think of heart disease
Mm-hmm.
and you think, okay, diabetes, high blood pressure, smoking, these are all risk factors that increase your risk of heart disease.
Mm-hmm.
Well, head injuries increase your risk for, like I said, Parkinson's, dementia. And
Mm.
so they should stay on your problem list for a lifetime, and your
Yeah.
general practitioner should be reevaluating it every year when you go in your physical. And they should be saying stuff like, make sure you don't have a second impact on your head because you've already had one. Because if you have a second one, it increases your risk of worsening symptoms and permanent disabilities. Make sure
Mm.
you keep your blood pressure, your weight, or blood sugars under control, because we don't want you to have a stroke. Because if you add a stroke on top of a history of traumatic brain injury, you're increasing your risk of developing dementia later in life. You see that picture?
Mm-hmm.
So it
Yeah.
shouldn't just be, which happened to me. I saw my general practitioner. She said, "Oh, you'll
Mm-hmm.
be better in 2 weeks.
Mm-hmm.
Call me and let me know if there's any issues." Well, a lot of people after a concussion or a traumatic brain injury lose that self-awareness, the awareness
Mm.
that something is wrong. They're not
Yeah.
aware that something's wrong, that they should go talk to the doctor. I just demonstrated it. I'm falling asleep at the wheel. Did I
Uh-huh.
contact my doctor? Oh, no.
No.
I didn't
Yeah.
have self-awareness at that time.
Because it's a new normal. It's a, oh, hey, this is just something that was presented to me. I'll take it as it is.
Yeah, and
Because,
I'll power through.
yeah,
Yeah,
yeah, exactly. And that wasn't the case, though, was it?
I tried, but it didn't work.
Man, that is actually really scary that TBIs are actually so, well, not chronic, but something that is can manifest so much more from something seemingly innocuous, you know? It's something simple and something that seems like it happened so I can get over it like everything else and I'll be totally fine. But you're saying that the TBI actually affects us on the cellular level to where that needs to be healed. And if that's not healed properly, what actually will happen besides the dementia, the Parkinson's? Does it actually can it progress to where it gets just worse and worse and worse if you don't heal proper? And how what does healing from a TBI actually look like? You can't just sit there and do nothing all day, right?
Right, right. Very good questions. I can speak to the risks of
Mhm.
not treating, recognizing a traumatic brain injury and addressing that patient's needs. If you see one traumatic brain injury, you've seen one traumatic brain injury.
Mm.
Everyone's response to a head injury is as individual as their personalities. And
Mm.
so the symptoms that they end up having, and there's some general symptoms that a lot of us share, but
Mhm.
everyone's just different. And if the person doesn't recognize the symptoms or the general practitioner or their specialist doesn't recognize the symptoms, then
Mhm.
the symptoms can manifest in that person's life. So if,
Mhm.
say, they're trying to go back to work
Mhm.
and they have maybe light sensitivity, sound sensitivity,
Mm.
difficulty with multitasking, and then they're at work and someone comes to their desk to ask and interrupts their work to ask them to do something else, they may
Mhm.
snap and get
Yeah.
grumpy.
Yeah.
Now, that's not them, that's their brain being overwhelmed and making them irritable. Well, if that happens a couple times and the person doesn't realize this is happening, then everyone at the office is going to be like, what's wrong with John?
Mhm.
He's really grumpy and he's snapping at people, and I don't like working with him. It's difficult to approach him. John may lose his job
Mhm.
because of these
Yeah.
personality changes, these behavioral issues, not being able to modulate his moods. Then
Mhm.
he loses his job. He may be irritable and grumpy at home
Mhm.
and may lose his relationship with his family at
Mm.
home. And then maybe he starts to drink
Mhm.
to help him relax and deal with his depression. And you see
Mhm.
how the symptoms, if they're not recognized, treated, and the person's not
Mhm.
supported, their life can spiral. There's a good percentage, I'm sorry, I don't know the percentage, of population who are TBI survivors that are incarcerated.
Mm.
There's a good
Man.
percentage of military personnel who are TBI survivors who have been put on administrative leave because,
Man.
of their behavior or, because they're not
Mhm.
able to continue to work.
Yeah. Man. You really got me like really questioning like how much of my concussion from early on in life, how much of that really screwed me up because you're saying all these things and I'm going like, I don't really remember like how I was temperamental wise before that because after that that was my normal. That was
Your new
what
normal,
everything
yeah.
was. And I was so young that I don't even know if I had a developed personality or not, but I've definitely been diagnosed with bipolar 1, having manic and depressive episodes, and I've had anxiety issues, I've had memory issues, I've fallen into substance use because of all those, and it really does make me wonder, like, did it all start because I had a bad bonk on the head and just wasn't treated properly? So,
Yeah. So, I mean, we can only hypothesize at this point.
yeah.
Say if, the people that are around you knew more about brain injury and they
Mm-hmm.
went, oh, Keegan fell on his bike and he really smacked his forehead. That's
Uh-huh.
his frontal lobe. That's going to
Yeah.
be where his memory is and his speaking and talking and learning. So we're going
Mm-hmm.
to really have to support him
Mm-hmm.
as
And sorry.
yeah, oh, so yeah, support him in his learning and in school. And if he
Mm-hmm.
does have behaviors that are not conducive to building good relationships, then we
Mm-hmm.
need to point that out and say, hey, Keegan, I noticed today you're more grumpy and irritable. How's your brain doing today? Is it tired? I mean, this is true.
Yeah, yeah, no.
Are you having a bad brain day? Is it tired? Should we have you wear your dark glasses while you're in class? Uh,
I actually have tinted glasses and everything because I have light sensitivity issues.
yeah.
And so this is so strange. So maybe I got some digging to do. But what parts of your brain were affected and how did it affect you getting back to work? Because I was thankful that it happened whenever I was young. So I grew up with this weird new normal. Unfortunately for you, you were well developed with a personality and a life on top of that. So this was much more of something that literally shook your world. So which parts of your brain was it? Your prefrontal cortex? Was it your occipital lobe? Or what was it?
Because you don't see anything on this brain scan,
Mm-hmm.
I don't know the specific areas,
Mm-hmm.
but I can imagine when the body is flying at a certain speed, whether on a bike or
Mm-hmm.
in a car, and it stops suddenly, the brain is not locked into the skull. It actually
Mm-hmm.
slams to the front of the skull and back, and
Mm.
kind of goes back and forth.
Ooh, so it's a little bit of both.
Yeah,
It's a
it could
little bit of
be, yeah,
everything.
it can be everything. Concussions are more of a generalized injury rather than a specific injury like in a
Mm.
stroke or with
Mm.
a penetrating object.
Okay. Gotcha.
Yeah, yeah. And that's why everyone's symptoms are different, and you will
Ah.
have to see multiple providers, like
Mm-hmm.
speech therapists, neurotherapists, ophthalmologists for your vision, audiologists for your ears, mental health for any changes in your mental health or
Mm-hmm.
your role in the family, a change in your personality,
Mm.
or if you're having difficulty with behavioral issues like anger outbursts,
Mm-hmm.
impulsive behavior, difficulty with sleep, you'd want to see a psychiatrist. The people forget how great they are in managing those issues and symptoms. So yeah, it could be super complex.
Man. So, whenever you started managing your symptoms, how did you manage it though? Was it really just saying, like, I feel tired, so I'm going to take a nap in an appropriate place? Did it start off that way?
Well, it started off with me having no clue of what was going on. And
Mm-hmm.
then once I fell asleep at the wheel and started speaking to a speech therapist,
Mm.
I started learning more about the brain injury symptoms that I had because you normally when you leave the emergency room, they say, oh, come back and let us know if you have vomiting, dizziness, worsening headaches, seizure, or difficulty walking, come
Mm-hmm.
back. But they don't say, yeah, so if you notice that you're getting tired driving, let us know. So through my speech therapist really helped me. She did an evaluation and she pinpointed a lot of my symptoms for me.
Wow.
And she also gave me 2 book recommendations for my recovery that also had symptoms in them. So I
Mm-hmm.
learned more about brain injuries that way through these 2 books. And
Mm-hmm.
then the other way I learned about my symptoms was journaling.
Mm,
So
cool.
that's what I did. I would journal every day, which is what I definitely recommend for my patients right away. Start journaling, put those symptoms down. Are they getting better? Are they getting worse? What makes them worse? And what makes them better? And is physical therapy helping? Or is it making it worse? Or neurotherapy making it better?
Mm-hmm.
And in that way you can let your provider know what your symptoms are, what's working, what's not, and they
Mm-hmm.
can better figure out what your brain needs. Because if you come in and you say, I've been really dizzy, that's a non-specific symptom. That could be caused
Mm-hmm.
by a multitude of things. But if
Yeah.
you say, I'm dizzy when I scroll up and down on my phone and I watch action movies with fast moving objects in it,
Mm-hmm.
then they're going to know, oh, okay, you're having difficulty with eye tracking. So I'm going to have you see
Mm.
a neurotherapist.
Mm-hmm.
Or if you say, I have light sensitivity, headaches, um, poor screen time tolerance, difficulty with reading. I have neck pain because I'm tilting my head for some reason. Well, if you see a behavioral optometrist, these are specialists who look at how well the eyes work together. They
Mm-hmm.
can treat because your vision can get knocked offline, and mine
Mm-hmm.
was, and it's called
Oof.
binocular vision dysfunction. It's when your
Mm.
vision doesn't line up, so you tilt your head to correct it.
I do that. I've always had my head just tilted to the left, just a smidgen, and I've never known why. Everyone's always been like, "Why do you do that?" And I'm like, "I don't know. It just feels right." Just and it's also slightly like this feels odd. Like I feel off, but this
Yeah.
feels right. I
Yeah, mine was
okay.
always to the right. And so my neck
Interesting.
was killing me. And I saw a behavioral optometrist,
Huh.
and you can find one. I think it's like a behavioral optometrist association. They're different from optometrists.
Mm-hmm.
Optometrists, they look at your eyes to see how clear you see. So are you seeing blurry or are you seeing clear?
Hmm.
And then ophthalmologist is good to see if you have diplopia or double vision, and they can
Mm-hmm.
fix that vision with prism glasses. But a behavioral optometrist can actually evaluate your eyes' performance working together and your visual and sending the information to your visual processing center in your brain. And they usually treat issues either with eye exercises, or
Mm-hmm.
if you have the binocular vision dysfunction, they
Huh.
can set your prescription to get your vision aligned. And then you can hold your head up, right?
That's so strange and very interesting. I had no idea that TBIs could really mess up like everything, and boy, oh boy, oh boy, it makes a lot more sense in my case. And I can only imagine you've dug and dug, you've done your research. This is awesome because you help people through their TBIs now. So, what is one of you said journaling is one of the best things. What is it about journaling that makes it so effective?
Well, after a brain injury, you really do get kind of stuck inside your head. And
Mm-hmm.
when you're stuck inside your head, you're stuck with those bullies that like to ruminate about negative thoughts and tell
Uh,
you you're not enough, and that you're stupid, that you can't do this.
mm-hmm.
If you journal, you get out of your brain and you put that on
Mm-hmm.
paper, and you can look at those thoughts and go, okay, that's a stupid thought. We're going to work on not thinking about that. And, or you'll go, well, that's really crazy. I think I should talk to my therapist about that. Or, oh, I need to share that with my husband. You know what I mean? So it's a really good safe space to kind of work out
Mm-hmm.
these thoughts in your head. It's journaling, the movement of the hand, the writing is a great
Mm-hmm.
way to stimulate rewiring of your brain, also known as neuroplasticity.
Mm-hmm.
So that's why I really encourage my brain patients to really do the handwriting of their
Mm-hmm.
journal. It's a good place to keep track of all your symptoms, whether they're getting
Mm-hmm.
better or worse. It's a good way to reflect on your symptoms, like say,
Mm-hmm.
I snapped at my coworker today. I'm really not happy about that. What set me up for that? Did
Mm-hmm.
I work too long without taking a break? Was I
Mm-hmm.
hungry and I needed to eat something?
Mm-hmm.
Was it I couldn't come up with a professional response at the time? You know, I was thinking, please leave me alone. But you can't say that out loud, right? You hope you don't. But then you can reflect at the end of the day, okay, this is what happened. I think I worked too long without taking a break.
Mm-hmm.
Next time, I'm going to make sure I set an alarm to remind myself to take a break every 20 minutes or every 30 minutes or every hour, whatever I need. And
Mm-hmm.
that's how your journal can help you with your
Mm-hmm.
recovery too. Um, yeah, and you can also use your journal as an external memory aid. So you could put to-do lists inside of it. And which is good because you should have your journal with you at all times. I tell my patients you should get up with it in the morning and go to bed with it at night.
Mm.
And put your to-do list and your memory cues inside of it because you always have your journal. Don't put it on a piece of paper because you'll lose the piece of paper, right? So anyway, yeah, that's another good way to use your journal.
Okay. So journaling has a lot more superpowers than just putting thoughts on paper.
Yes.
I think that that would be great for really cataloging the things that work and don't work for some people. Because, like you said, everyone's a little bit different. And what if they tried something and then they're like, ah, that didn't work. And I'll have to write it down so I can remember it. But then they forget that they wrote it down. So then they have two entries. But then maybe they have two entries and not five different sticky notes all over the place, right?
Right, right. Or I want to ask this question of my doctor so they can put it in their journal,
Mm
like in a space that they've created in the journal, a list of questions for
hmm.
their
Mm hmm.
doctor and
Yeah.
which provider they want to ask that question of.
Yeah. And how do you suggest someone journal, or rather, how do you suggest someone start journaling if they haven't been able to before? What if they have an aversion to it for some reason? Or what if their TBI was actually severe enough it affected their handwriting?
Well, if they're not able to journal,
Mm-hmm.
I would have a caregiver journal for them
Okay.
and noting
Cool.
the symptoms and how they're sleeping and their behavior and what has
Mm-hmm.
helped and what hasn't helped,
Mm.
just for them to start it. But for a patient
Huh.
who is able to start and write, I usually say write the date, the
Mm-hmm.
date, today's day, because that's going to also help you with your memory.
Mm-hmm.
And if you slept well or not. Is today, did you sleep well? No, I didn't sleep well. I think today's going to be a bad brain day.
Mm-hmm.
So I'm only going to do the minimum today to get through the day and
Mm.
be kind to myself and my brain and rest when I can. That's,
Okay.
and then there's, you could also just draw
Yeah.
pictures.
Yeah.
That's helpful too. You can draw like a picture of how you're feeling at that time.
Hmm. That's a really good idea. Drawings have just as much of an emotional charge as words do, if not more. It really just depends on the person, and
Yeah.
maybe their skill level. I suck at drawing, so.
Yeah, I do too, but I still do it. Doodling is great for the brain, and it
Mm-hmm.
helps with anxiety and worry, and helps promote rewiring of the brain. And doodling
Mm.
also allows the brain a moment to rest, which, a lot of times we just go, go, go. We're either
Mm-hmm.
on our phone or we're at work or we're driving. There's very little downtime for our brain just to be.
Yeah. And so, do you think that that is the key to healing from TBIs? Is just letting the brain rest and do its thing?
There used to be this belief that you should rest and stay in a dark room after a concussion, but that's not
Mm-hmm.
necessarily true.
Mm-hmm.
Maybe rest the first 48 hours, but then
Mm-hmm.
start moving around and see what you can do.
Mm-hmm.
Note if anything you're doing makes your symptoms worse, and then just
Mm-hmm.
kind of back off and rest a little bit, try again.
Mm-hmm.
It's really quite the dance. In your recovery, you're always trying to push your brain to get stronger,
Mm-hmm.
but you don't want to push it so bad that you regress in your recovery and you're back to square one. And
Mm-hmm.
your journaling will help you with that,
Mm-hmm.
identifying those patterns and seeing when you can expand. And whoops, I screwed up. Now I'm having to sleep 12 hours a night for the next 3 nights, because I
Mm.
did such and such. Um,
Yeah. Okay. Cool. Real quick question. I may have asked this, or maybe it was just during the pre-recording, but during your journey, you've had your TBI actual episode where the incident happened, and then you have before and after. But with that after, it's the new normal. So, what really cataloged the difference between the two for you? Was there certain feelings, the lack of feelings? Was there almost a eureka moment, but like the reverse of one? Like, oh, duh, that's what it was. And is there something that you miss about your pre TBI brain that you wish you had now?
yeah, so when I had that car accident, that Kelly that day died,
Mm,
but my body survived. And I spent about 6 months to a year not knowing who I was. I really felt like I was living with a stranger in my head.
boy.
And that stranger was not nice. So before my brain injury, well, a little later into my recovery, for some reason, I decided I would go into my journal and I
Mm-hmm.
would write on the left side, I drew a line down the middle, and on the left side, I wrote everything I used to be passionate about, goals, things I loved before the car
Mm-hmm.
accident. And then on the right side, I wrote all the things that I thought I had gained from the car accident.
Hmm.
And what I didn't realize what I was doing was I was letting go of the old and embracing the new me. So the old me was very goal oriented,
Mm-hmm.
very go, go, go. I was like president of the nurse practitioner group in the area I live, Sacramento. I was a martial artist. I taught beginning Brazilian Jiu Jitsu classes to women.
Mm-hmm.
Traveled a lot. I was always on the go, very social, out the door, never staying
Mm-hmm.
home. Every weekend was packed. And then after my car accident, I slowed down. I had a more simple life filled with gratitude and mindfulness. Enjoyed just sitting in my home and being thankful for it. I enjoyed sitting off on my deck and being thankful for my deck, my plants. I enjoyed watching the birds flip from limb to limb. Just totally
Mm-hmm.
different person. Got into fashion, was before I was t-shirt jean gal. After the car accident, I was like, I have to look fabulous, and sparkles and makeup and fashion. And so I spent a lot of money on clothes. So yeah, I was a very different person, more patient, more understanding, more compassionate. And when I compared the two sides, I liked who I was becoming.
Mm.
And I just embraced that. Now, what do I miss? I miss
Mm-hmm.
that energy because I'm still plagued with neurofatigue. I still um, want to do a ton of stuff, but I only have so much energy.
Mm-hmm.
Um, I do miss that, but I wouldn't trade it for who I am today.
Man, that is a really cool list that you put down. And I think that that shows a lot of growth and maturity. And I mean, I don't know. Do you think that that came about from having to learn to accept life as it was now that you were handed it and not necessarily the flip of a switch?
Yes, I think it had that emotional intelligence really came into play during my recovery and just learning to be more aware of my brain and where knowing that like where's that thought coming from
Mm-hmm.
or why am I tired today or why am I sad, you know
Mm-hmm.
just when you're recovering you have to constantly reflect and monitor, is this working for me or is it not? And
Hmm.
that's how you maintain the health of your brain and move forward and learn to support your brain. Because you're after a brain injury, your brain may not go back to your old self,
Mm-hmm.
and so you're dealing with a new brain,
Mm-hmm.
new way of doing things.
Mm-hmm.
And so to discover or rediscover yourself, you really have to be in touch of those changes and what your brain needs.
Boy, that is really deep. And I love that because it really does go to show that there's just there's something beautiful in everything. And whenever you hear traumatic brain injury, it's like, oh no, brain on the wall. Like, that is like the worst case scenario. But thankfully, that's not really what's happening here. But still, hearing traumatic and then turning it into something beautiful really does require a whole bunch of emotional intelligence. It requires a bunch of strength and everything like that. So I'm just glad that you've been able to make it through and turn into this beautiful second Kelly, because then we get awesome conversations like this and we get to tell everyone out there like, hey, y'all may have had a TBI and y'all don't know it. And this is also a great way to help other people recognize that, hey, if someone has had a hit on the head, be gentle with them, be kind with them, because they may not be the same person they were. And I mean, it also is a testament to like how sensitive the brain is, I guess.
Yeah, it's just a squishy little organ. To think that it's gonna heal 100%. I mean, if you fracture your ankle is gonna always be sore, sore or achy during the winter. It may swell
Mm-hmm.
up. It may
Yeah.
be easier to sprain, but you expect the
Mm-hmm.
brain to
Yeah.
bounce back in 2 weeks? That's crazy thinking.
Yeah, I mean, and I can't tell you how many I've actually had myself because I grew up as a skateboarder and just being a rambunctious teenager. So I know I have one back here, one up here, and actually, no, two or three right on the frontal lobe. It's bad. I mean, I don't know if you can hear that, but my skull is just too thick. And is there anything that you've noticed physically about your head that has changed? Do you get sensations that feel different? Do you feel your emotions come on in a different way?
I have no sensations, but I have heard from some of my patients that they can have like residual symptoms, especially if they had a skull fracture or they've had brain surgery where they had a
Mm-hmm.
craniotomy to relieve pressure off the brain because they had a bleed. And
Ooh.
so, yeah, I've had patients have chronic pain from craniotomies. And then, headaches can be an issue. You can have prolonged headaches. I had a
Mm-hmm.
headache every day for 4 years after my brain injury.
Deesh.
It, yeah. And so someone can go from not having a history of migraine headaches, then having a concussion, and then having a history of chronic
Mm-hmm.
migraines.
Mm-hmm.
So I never discount anything. We don't know 100% about the brain. I just, I tell my patients, I'm not sure why you're feeling that way, but
Mm-hmm.
I believe that you are. And as long as it's not impacting your day-to-day life, then, it's just
Mm-hmm.
something you have now after your injury.
And I think that that's one of the important parts is the acceptance part. Did you fight yourself on uh, accepting it?
Yeah, that especially with that first 3 months, you
Mm-hmm.
know, I was gonna go back to work. I was gonna be a mom. I didn't care if I had headaches or neck pain, or I was gonna make it work. And I even went back to training in my martial arts. I was testing
Ooh.
for my third degree black belt at the time and a purple belt in Brazilian Jiu-Jitsu.
Wow.
And I pushed and pushed and pushed, but yeah, it was a big failure because I just wasn't
Mm.
aware
Mm-hmm.
um, that I needed to operate differently and allow my
Mm-hmm.
brain to heal.
Okay. Now that you've learned to operate differently, now that you've become Kelly 2.0 and now that you're a little bit more on the I wouldn't say slow roll, but maybe the gratitude roll, instead of the hurry up and bustle. Hold up. That thought is right there. It's running away. Oh no. It may come back. It may come back. It may not. Let's see. Preloaded questions. Come here. No, so whenever you're dealing with now that you're Kelly 2.0 and everything is more on the gratitude side and you've gotten comfortable with where you're at. One of the things that you said earlier was you miss the energy levels that you used to have. So, how do you deal with having less now? Is it just going with the fact that it is what it is? Do you really try to schedule your day out? How far ahead can you schedule?
Yeah, so some people call it like spoon. Um,
Spoons? Yeah, I
yeah,
know that. I use that
yeah.
term.
And yeah, unfortunately, I can't figure out my spoons. So, but, over the years, I've gotten to kind of know myself better.
Mm-hmm.
It has gotten better. So,
Huh.
originally, the first 2 years, I had to sleep like 12 to 14 hours a night
Oof. Wow.
during the weekends and take a
Mm-hmm.
2 hour nap. And Monday through Friday, I would come
Mm-hmm.
home from work, I would take a 2 hour nap. I'd get up for an hour, get ready for work the next day, and go back to sleep. So the first 2 years,
Wow.
all I did was sleep. That was it. The third year, I was able to actually start exercising, going on walks
Hmm.
on my days off. Now, not on the days that I worked, but on my days off.
Uh-huh.
And, eventually I settled down to just needing about 9 to 10 hours of sleep at year 4 and 5. At
Hmm.
year 5, I really expanded my abilities to learn more, read more.
Mm-hmm.
And now it's more like I just really need like 8.5 to 9 hours of sleep. And I'm familiar when I'm getting to the point where I need to take a break and when I
Hmm.
need to quit for the day.
Okay.
And it just took a really long time to kind of figure that out.
Mm-hmm. And it's definitely not something that you can do overnight. And you definitely said that journaling is what helped you get to that point in the first place, right?
Yes. Yes, for sure.
So, what other tricks and tips do you got for someone that is possibly dealing with a TBI right now?
So I do have my 5 pillars of recovery.
Ooh,
Yeah. And those, hold on.
I was just about to say, well, what are those? Your camera kind of like froze, and I didn't know like that. Okay, you're still there.
I'm still here. Yeah. I'm trying to, I really apologize about this.
No worries.
I'm trying to plug in my phone. There we
No.
go. Because I was going to do the laptop thing with you.
And
Okay.
laptops definitely have, well, I don't know. Sometimes their batteries are better than phones.
Yeah.
Guess it just just kind of depends nowadays.
Hopefully you can edit that out. Sorry about
Yeah.
that.
Oh yeah. I mean, everyone watching the live stream, sorry you have to watch it live stream, but you know.
All right. 5 pillars of
All right.
recovery. Sleep. You should get,
Ooh,
even with healthy brains, you should get 7 to 9 hours of sleep every night.
I don't get that.
Exercise. And exercise could be just simply walking or doing yoga or chair yoga if you have balance issues.
Cool.
And, start off, if you're someone who doesn't exercise,
Mm-hmm.
walk out your door 5 minutes, come back 5 minutes, just 10 minutes,
Mm-hmm.
2 or 3 times a week, and then
Mm-hmm.
slowly increase that over time.
Okay.
The other is mindfulness. Like I said before, people with brain injuries tend to get trapped in our heads, and being
Mm-hmm.
mindful and in the present moment will help you get out of your head. It also helps with getting clarity of your thoughts and
Mm-hmm.
in touch with your values and your passions. And mindfulness can be done either through deep breathing exercises. You could do
Mm-hmm.
adult coloring, the
Mm-hmm.
doodling that I talked about. You could sit outside and open your senses to your environment, such as feeling the
Mm-hmm.
wind on your face, the warmth of the sun, listening to the birds chirp
Mm-hmm.
and the dogs bark in your neighborhood, and just really enjoying that moment. And
Mm.
mindfulness can be practiced in 1 to 2 minutes or longer, 15, 20 minutes. It's best to, if you've never done it before, to start off with just 1 to 2 minutes and then expand as you can.
Mm-hmm.
The um, other thing is nutrition. So I
Nutrition.
recommend a low inflammatory nutrition that would be avoiding processed foods, things in packages because of the
Mm.
preservatives and ingredients that aren't really necessary. So
Mm-hmm.
what I tell my patients is, instead of drinking the orange juice, eat the orange. Instead of cooking or pouring olive oil on your salad, eat olives. So really
Uh.
getting closer to the ground and far away from the factory is the best
Mm. Okay.
nutrition. So lots of vegetables, fruits, whole grains, beans, legumes, and then limiting or avoiding completely animal protein and dairy.
Mm-hmm.
Both of those are really high in saturated fats, and
Mm-hmm.
saturated fats increase your risk of stroke. So we don't want that.
Yeah.
And then dairy is very inflammatory to the body.
Mm-hmm.
When your brain's healing and trying to clean out debris, you really don't want to be adding to that inflammation.
No.
And the more fruits and vegetables you eat, the better your gut biome, and we're finding more and more how the brain and the stomach are very well connected and communicate with each other. And most of our serotonin is actually produced in the gut. Um,
I had no
so
idea.
yeah, through the vagus nerve, which is a cranial nerve from the brain to the chest and abdomen area. And then the last one, the fifth one, is financial wellness. Yeah, because if you can't pay your bills, you're going to be stressed, and it's going to be hard for your brain to heal if you're under a lot of stress or you're worried about getting back to work or paying your bills and so forth.
Mm-hmm.
So I usually recommend cutting back on any unnecessary expenses after a concussion until you know you're back to
Mm-hmm.
work full time. So get rid of those magazine subscriptions, any digital subscriptions, cancel your gym membership until you know you're able to go back and exercise. And then I've had some patients have issues with impulse control, impulse buying. And so we've had to talk about, like, taking the credit card off of PayPal.
Huh.
Don't have the easy access to your credit card when you go to an app, purchasing apps, taking those out.
Mm-hmm.
Not using credit cards and only taking cash when you go out and about. So those kinds of things. And
Mm-hmm.
then if it looks like you're not going to be able to go back to work full time, or you're going to have to take an early retirement or change your career,
Mm-hmm.
to talk to a financial planner.
Mm.
And if you're having difficulty with your budget, there are actually financial coaches that can help you
Mm-hmm.
with your financial goals and help you
Ah,
with your budget.
okay. That's a really, really good last pillar because I was like, man, those are some pretty good ones. I would definitely say those would all help out my brain. And then that last one is like, yeah, you know that saying like I got 99 problems. Yeah, but all of them could be solved by money.
Yeah. Yes, it's very, very important. And money becomes really a big issue because it's very difficult to calculate, well, how much of is that disability check going to be?
Mm-hmm.
Paying your bills on time. A lot of people after a concussion or brain injury have difficulty paying them on time. So then you're
Mm-hmm.
paying fees and penalties that you really can't afford. And then there's a lot of out of pocket costs with your therapies that may not be covered by your insurance plan that
Yeah.
you're going to have to pay for and budget for too.
Yeah, and I didn't even really think about that. Insurance having to pay for TBI stuff is going to be a little bit difficult, huh?
Yeah.
Boy.
Hmm.
So did you have any issues with that on your end?
Yes, I had to pay a lot of money out of pocket. My
Oof.
behavioral optometry wasn't covered.
Mm-hmm.
I had acupuncture for my neck that was not covered. A massage
Mm.
therapy for the neck also
Mm-hmm.
wasn't covered. And then I saw a neurobehavioralist that wasn't covered. I had to pay out of
Mm-hmm.
pocket. So yeah,
Boy, man, I'm really sorry that it was so rough in that regard. I guess that's why that is that fifth pillar after all, and I think it's a really, really good one. So is that all those pillars can be found in your book, correct?
yes.
Awesome. And I'm sure that there's a whole lot more that we can dive into, but we are right near the end of this episode, which is unfortunate because this is super fun. And I don't know if I'm picking your brain or if I'm picking my own brain trying to figure out like actually what happened, you know? Because it's like I feel like there's some actual answers that could be answered here, but it's kind of like so far in the past, it's like it is what it is. So I'm glad that you're sitting here and helping out people with TBIs now, that you're helping people and families recognize what they are, what they can do different, what they can do to support the people or person going through TBI recovery because it's multifaceted. It's not just sit down and rest, you'll be okay, and it's a chronic thing. So it is something that we need people like you. We need advocates and we need just compassionate souls. So thank you for being one of those.
My pleasure.
Of course. And I do have to ask, do you think we could see you on the show in the future to dive in a little bit deeper?
Yeah, definitely.
Okay, sweet. So I'm not sure when that'll be, but it will be plenty of time for us to play catch up, see how Kelly 2.0 is doing, and see if I have any answers or more questions for you because I'm pretty sure I have quite a few.
Write them down.
Because I will forget. And everyone out there, this has been Kelly Tuttle, and she is author of After the Crash, everything to do with TBI recovery. So check it out. Where can everyone find your book, by the way?
You can find me and a lot of information I'm working on at kellytuttle.org.
Kelly
But you
Tuttle,
can find my book on Amazon and Audible too.
Amazon and Audible too. Sweet. And I do have one other question for you. Do you know a little number that someone can call if they're having suicidal ideations or they got a bad grade on their report card or maybe they just found out they have a TBI?
988.
Yes. Awesome.
Very important
Thank
number to talk about.
Yes,
Yes.
it is. Thank you for knowing that and thank you for helping spread the message.
Yeah,
So,
for sure. Anytime.
well, Kelly, it has been an absolute pleasure to have you on the show, and everyone out there, thank you for listening to Retrieving Sanity on WDJY 99.1 FM. I hope you have a wonderful rest of your day or evening, whenever it is that you may be listening to this. And everyone, check out Kelly's book, After the Crash. So, one more time, thank you, Kelly, and everyone out there, y'all have a wonderful day. Schlag.